first test we're gonna do is the drop arm test. For this one, she's gonna be standing. You can also do it sitting. And for this one, I'm gonna have my patient make sure her arm stays in external rotation with the forearm supinated. And she's going to bring her arm, abduct her arm all the way up, and then slowly bring it back down to her side. And if during this the arm falls uncontrollably around like the 90-degree area, that could indicate a rotator cuff lesion, but more specifically the supraspinatus. And so if she is able to fully control that movement all the way back down, we could then do a derivative drop arm test. And for this one, I'm gonna have my patient hold her arm all the way out to 90 degrees of abduction, and I'm gonna put a downward pressure on the distal part of her arm. And if during that pressure, when I put that pressure on her arm, if it falls to the side, that could indicate a rotator cuff lesion as well. Next test is the modified belly test. For this one, she's gonna be standing or sitting. We're gonna do it standing. And her hands are gonna be flat on her belly, and her elbows are gonna be back to the side. So like that. And for this one, I'm gonna ask her to bring her elbows forward in order to straighten that angle at her wrist. And so when she does that, I'm gonna bilaterally compare those angles at the wrist. And if there's a difference of at least 10 degrees, that could indicate a subscapularis injury. Next one is the belly off test. And for this one, she's gonna be seated. Okay. And she's gonna have her hand on her belly with her elbow, arm like straight. And I'm gonna support the elbow and then push her hand like farther into her stomach. And then I'm gonna release that position and ask her to hold it herself. And if her arm comes off her belly like she did there, that would indicate subscapularis injury.